Hello, my name is Chuck Hudspeth. I'm an insurance broker in Memphis, Tennessee. I'm with Hudspeth Benefits Group, and I have been selling group and individual health insurance for about 20 years. And today I would like to talk to you about healthcare reform from an employer's perspective. The Affordable Care Act was passed back in 2010, and it makes sweeping changes to the health insurance market by imposing mandates on individuals, employers, insurance carriers, and even states. The law includes new taxes for some, while providing tax credits and subsidies for others. Different provisions of the law started phasing in back in 2010 and will continue to do so all the way through the year 2018. Well, why don't we just dig right in? We're going to be talking, like I said, about how this affects employers. So the first thing that most people have heard is that employers are going to be mandated to provide insurance. This is sometimes known as pay or play. This applies to employers with 50 or more full-time equivalent employees in the prior calendar year. So if you are a very small employer, this is not something that you need to worry about, but it's definitely something you need to worry about if you're a large employer. The penalties will apply if an employer does not provide health insurance to all their full-time employees, and if any full-time employee gets subsidized health insurance through an exchange. A penalty can also apply if an employer does offer health insurance, but any full-time employee still gets subsidized insurance through an exchange. So what is a large employer? Well, to qualify, an employer must employ, on average, at least 50 full-time employees, including full-time equivalent employees during the preceding calendar year. Full-time means 30 or more hours of service each week. Now, if you're a very large employer, you have 100 employees, then you know that you're going to be full-time. If you're very small, you have no more than 10 employees, you know that you're not going to be subject to this section of the law. But if you're sort of in the middle, it may be important to figure out whether or not you actually qualify as a large employer. So the IRS has provided some rules or instructions on how to do it, and I'm going to work through these with you. So the first thing you need to do is identify your regular full-time employees. Those are the ones that ordinarily work 30 hours a week, and you just need to add these up for each month in the preceding calendar year. So I have here on this little chart a fictitious company. They've got about 40 full-time employees. All right. The next thing you need to do is figure out what to do about your full-time equivalent employees, and these are part-time employees. Now, what you're supposed to do is you're supposed to aggregate the hours worked by these employees. However, you need to make sure not to include any hours for a single employee if he works more than 120 hours in a particular month. So, for example, if I have two part-time employees and one works 80 hours, then you're going to add 80 hours to this total. If you have another employee that works 150 hours, then you're only going to include 120 hours for that employee. So anyway, you take all of these part-time employees and you add up their hours. So you can see here 1,200 hours, 1,100 hours, 1,300 hours. And once you do this, then you're going to divide this number, each of these numbers, by 120. When you do this, you're going to get a number of full-time equivalent employees. And you can see in some of these cases we have a nice round number. In other cases you have little fractions. Once you've done this, you need to take the number of full-time employees, add it to the number of full-time equivalent employees, and then you're going to have your total number of employees. And once you do this, you take these numbers and you average it over 12 months. And in this example, I've come up with 49.9 employees. And for the final computation, you get to round down or discard that fraction. So in my example here, this group has 49 full-time and equivalent employees. So this would not be a large employer. The other thing you need to think about is that if you own multiple businesses, you will likely have to include them for determining whether or not you're a large employer. Basically, the rules say that if you are a control group under certain sections of the law, then you have to add these employees together and combine them to determine if you are a large employer or not. Now the rules are actually pretty complicated. If you want to figure out if you're a control group, you probably really need to go talk to your CPA or an attorney, but I'm going to give you a few little basics. There are two general types of control groups. There's a type known as a parent subsidiary group and another type as a brother sister group. Basically, a parent subsidiary group is one where you own or control more than 80% of the stock. So for instance, if I own two companies and I own 80% of both of them or each of them, then this certainly would be a control group. It can also be a control group if I own a company and I own more than 80% of it, and my company owns another company, and it owns 80% of that company. It would also be a control group. There's another type called a brother-sister group, and this occurs when you have 5 or fewer common owners. The owners can be an individual or another corporation, and you have two tests that you look at then. The first one is a controlling interest test, and it generally means that the 5 or fewer people own 80% or more of the stock in each company, and these people also have to have effective control, which means that the identical ownership of each person when you add it together has got to exceed 50%. And I've got a little example to show you what I'm talking about. So here we have two corporations, Corporation 1 and 2. It's owned by 4 different owners. And so the first thing we look at is the first test, whether or not these people control 80% or more of the companies. And in my example, they actually own 100% of the group, so we are passing this first test. Then the next thing that you have to do is look at identical ownership. All right, so let me show you what that means. Owner A owns 80% of Corporation 1 and 20% of Corporation 2, so his identical ownership in the two companies is 20%. All right, and we just go through this calculation for each owner, and we add this up. And in my example, this number turned out to be 40%. So since this is less than 50%, it fails. So this example would not be considered a control group. One other thing that you need to be aware of is that there are family attribution rules. So you can have a situation where you have a parent and a child, or a husband and wife that have ownership in multiple companies, and they can be deemed to be one company as well. All right, so if you're a large employer, once we figured out that you are a large employer, you have a choice. You can either try to offer insurance to your employees, or you can choose not to offer insurance. So first thing we're going to do is talk about what happens if you choose not to offer the insurance. Large employers who choose not to provide health insurance will be subject to an assessable penalty equal to $2,000 times the number of full-time employees less 30. And this is only the case if one employee obtains subsidized health insurance on an exchange. So suppose you're a large employer, you've got 100 employees, and you don't offer insurance. If none of your employees go get insurance on an exchange and none of them qualify for a subsidy, then you will not pay a penalty. Now I'm going to just assume that at least one person is going to do it, and I'm going to show you how you figure out what your penalty will be. A full-time employee is one who works 130 hours a month, and the actual penalties will be determined and assessed on a monthly basis. Now you're not going to actually get a bill every month for how much you owe. This is going to be something that's determined at the end of the year, but the IRS will look at the total number of employees you have on a month-by-month basis to determine your penalty. So here's my example. I've got an employer. They have 100 full-time employees. So we take the assessment of $2,000, but we're going to divide it by 12, so that'd be about $167 a month. Multiply that times 100 minus 30, so you get a penalty of about $11,000. Say that next month the number of employees goes up. We do the same computation and we get a higher penalty. So as you can see here, as your employment goes up and down, your penalty will go up and down each month as well. Now the next thing to remember, and this is important, is that since these are penalties, they are not a tax-deductible expense, and therefore are more costly than a deductible business expense like a wage or an insurance premium. So suppose that you have a business that is in a 35% tax bracket, and it's earning about $3,000. We have $3,000 of earnings. In that tax bracket, the income tax would work out to be $1,076, which would leave you exactly $2,000 left over to pay a penalty. Now let's say instead that we have a company with the same amount of earnings and it wanted to spend that money on something like an insurance premium. In this case, I've chosen it to be $2,000. You take $3,000 minus 2, it leaves you a profit of $1,000. You pay your taxes on it, and you end up with a net income or net profit of $700. The point that I'm trying to make here is that these penalties are actually a little bit more expensive than they appear. All right. So we've talked about what happens if you don't offer insurance. Well, what if you want to try to do it? There are a couple of things that you're going to have to make sure that you do. It's not just enough to offer health insurance. Your coverage is going to have to meet 3 criteria. First of all, the coverage is going to have to be good enough. And this is defined in the law as having an actuarial value of 60%. And I'm going to talk a little bit more about that in just a minute. The coverage has to be affordable, and it is also specifically defined in the law, and I'll talk about that in a minute. And finally, the coverage has to be offered to 95% of full-time employees. Now what this really means is that later on in the future, the IRS may come and audit your group to figure out if you are meeting these rules, and they're going to check to see that you offered coverage to your full-time employees. They realize that it's possible for an employer to make a mistake. So if a small number of employees, if it cannot be proven that they were offered the insurance, the IRS isn't going to automatically impose the penalties, but you need to be able to prove that you can offer that you have offered coverage to 95% of your full-time employees. Okay, so what does it mean for the coverage to be good enough? 60% actuarial value means that on average, the plan would be expected to pay 60% of covered claims, and the participants would pay the other 40%. Now this is not the claims on your group, it's on the insurance company's block of business. So this is just a sort of a number well, for example, let's suppose that we had a large set of people in the state and they had $100 million worth of claims. What it means is that the insurance policy itself would pay $60 million, and the participants would pay the other $40 million out of their pocket. Of course, you might wonder, well, what kind of policy would that look like? Luckily, the IRS has just sent out some new rules. They have some proposed safe harbor plan designs that they think would meet this rule. So here are some examples, and this will give you an idea of what that would look like. So plan number 1 has a $3,500 deductible. It pays 80% after the deductible until the individual spends $6,000 out of his or her pocket. Prescription drugs in this case would be subject to the deductible. So this is not a super rich plan, but it's not a really terrible plan either. Here are a couple of other examples. This second plan has a $4,500 deductible. It pays 70% with a $6,000 out-of-pocket maximum. And the second plan is also a health savings account plan, which I'm not going to get into details of today, but in this example, the employer is also putting $500 into that HSA. And finally, we have a design with a $3,500 deductible that pays 60% after that with a $6,400 out-of-pocket maximum. And by the way, all that means is that once you spent $6,400 on this plan, it's going to start paying 100% after that. And this last plan also has a prescription drug card where some drugs have a $10 copay and they get higher depending on what the formulary says. Okay, so we've talked about the coverage. It has to be good enough. The next thing is that the coverage has to be affordable. All right, the way the law was written, the employee's cost share for his family coverage cannot exceed 9.5% of his household income. The problem for an employer, though, is that you would not know how much your employee's household income is. You don't know who is in the household. You know what you pay the employee, but you don't know these other things. And the IRS realized that this would be something that would be impossible to manage for employers, so they have proposed a safe harbor rule that basically says that an employer would not be subject to a penalty if the employee's share of the employee-only premium does not exceed 9.5% of that employee's income. So you're going to be required to offer insurance for the employee, and you have to offer insurance for his family, but you do not have to subsidize the insurance for the family, just for the employee's premiums for himself. All right. So, and you can use a couple of different ways to come up with this number. You can use the employee's W-2 wages. You can also use the employee's hourly rate of pay if you like, and you would just simply multiply that times 130 hours. So, for example, if I have an employee that I pay $10 an hour, we would come up with a number of $130, and it could not exceed 9.5% of that. Also, if you have some employees that have very low incomes, you can also use 100% of the federal poverty level. And for 2013, the federal poverty level is $11,500 for the 48 states and the District of Columbia. All right, so let's show you an example. Oh, by the way, I forgot to mention this. You only have to worry about subsidizing coverage for employees that make less than 4 times the federal poverty level, which is about $46,000. So if an employee makes more than this number, you do not have to subsidize his insurance coverage. So anyway, let's take a look at this example. I have an employee that's making $20,000 a year, and we're going to assume that the insurance costs $5,000. In this case, the employee's share would have to be $1,900, which is 9.5% of his income. The employer would pay the difference. All right, if that same employee made $30,000, then the employee's cost share could rise to $2,800, and the employer's share would be reduced to $2,100. If you had an employee making $40,000, the employee's share could be $3,800. And if that employee is making $50,000, he's actually making more than 4 times the federal poverty level. So as far as the law is concerned, the employer does not have to subsidize his premium at all. Now, a complicating factor is that today, most insurance companies require an employer to pay at least 50% of the employee-only premium. The proposed regulations actually still permit insurance companies to have their own issue and participation rules, but we don't know today whether or not the insurance carriers will continue to impose these requirements. All right, so as I said before, if an employer is going to offer insurance, it has to do 3 things to avoid penalties. The coverage has to be good enough, it has to be affordable, and it has to be offered to 95% of all full-time employees. So let's suppose that you try to do this, but in some way you fail. Perhaps the coverage isn't good enough, or it's not affordable, or you didn't keep good records and you can't prove that you offered it to your employees. So in this case, you could still be subject to a penalty, and this would occur if you offer the insurance, but again, something doesn't work, and one of your employees goes out and gets insurance on the exchange and is eligible for a subsidy. If that happens, then you're going to pay $3,000 each time an employee does this. So if you have 2 employees that go get insurance on the exchange and get a subsidy, you'll pay $6,000. Now, if you have a lot of employees that run out and do this, the penalty, even though this penalty is actually larger per person, it will be no larger than the penalty that you would have paid if you had offered no insurance at all. In other words, it's capped at $2,000 times the number of full-time employees less the first 30. Okay, so when do the penalties begin? Well, if you don't have a plan right now, you're going to be required to comply with the law January the 1st, 2014. Some employers, a lot of employers have existing plans, and in these cases, it may be that you do not have to comply until your plan renews. There's a rule, a transition relief rule, that basically says that if a large employer maintains a fiscal plan year, and a fiscal plan year is a plan year that is not January the 1st through December the 31st. If it maintains a fiscal plan year as of December the 27th, 2010, then this relief will apply with respect to employees of this large employer who will be eligible for coverage as of the first day of the first fiscal year of that plan that begins in 2014 under the eligibility terms of the plan as in effect on December 27, 2012. Now that's a pretty hard thing to read, but what it essentially means is that if you have a plan that was in existence on December 27, 2012, and you have certain sets of eligibility rules, if you continue to follow those rules, then you will not be subject to a penalty or an assessable penalty until your plan renews in 2014. All right. Well, this is all pretty complicated. And of course, if the government's going to be coming in figuring out whether or not you did these things, the government has to know what's going on in your company. So large employers are also going to have to start reporting a lot of extra information to the government.